Hi, I'm Dr. Nicole Vane. Thank you for taking your time to watch this video. I wanted to do a quick video on detox. There's a lot of other videos I have on mercury detox. If you're someone like myself that has autoimmune issues or the MTHFR gene, that means I don't methylate things well or clear them from my system. So my liver detox, my phase 2 liver detox specifically, is horrendous. So I tend to not take anything for anything. If even after major surgery, I've maybe taken a little bit of Advil and then that's it. For headaches, I had never taken anything, and I have a great solution for that now with the CBD. But I am continually doing a detox, and it's something I'll have to do for the rest of my life. And it's interesting because my parents, obviously my genetics came from them, ended up being lead toxic based on the way they were filtering their water. They were doing a reverse osmosis system and ended up being very toxic in lead, antimony, and arsenic. So these will help detox that also. And environmentally, we are just far more burdened than we would ever like to imagine with fertilizers and whatnot. So how do we help clear that? I'll tell you what I do. The first one is milk thistle is good for biliary cleansing, and it helps upregulate, get your liver to work a little bit better at pushing things out. So essentially this is going to push things out into your poop, which is great, right? Our main forms of excretion are urine, sweat, and feces. So this milk thistle will help detox. It's a liposomal form, which means it's going to be 95% absorbed. I used to take like milk thistle tea or dandelion tea, and you can still do that. It just be aware that it's a very, very weak form. So you're going to need a whole lot of tea. The only good thing with that is that you'll then be urinating some more stuff out, but it's not going to help you detox as well as taking a supplement. So there's milk thistle. There's something called DIM, which helps with detoxing your liver also. It helps, again, for people that are non-methylators or autoimmune, really get things cleared out. There's also the ClearWay cofactors. I really like these as well as the mercury detox box. The detox box is great for any detox. So because I'm not good at detoxing, I take these and the mercury cube every day, actually, the binding powder, the push catch. But these ClearWay cofactors are very easy to take, and I've had a lot of people referred now to take these by their naturopath for a variety of other detox issues. The last, which was somewhat unexpected as I've gotten more training in the use of CBD, and I have 2 forms now at the office, is how important CBD is in detox. The reason that is it's part of your parasympathetic system. It turns on your parasympathetic. So what's parasympathetic? This is getting down to biology, right? Sympathetic is fight or flight. That gets our body in action to run away from things that fear, whatever. It gets our body primed for exercise, whatnot. Parasympathetic is rest and digest. So a lot of us aren't good at turning on that pathway. 1, we're so tightly wound, and 2, we're very nutrient deficient based on our American diet, which is horrendous. So the terpenes and the cannabinoids bind to receptors that are always present and have been present for thousands and thousands of years, but we're just no longer getting the supplementation we would normally have gotten from food, hence our modern day illnesses. So this is really important for turning on your detox pathway. So if you are going to take any other supplements, believe it or not, a daily dose of CBD is really important. And I'm also finding that useful right now, even with my dog's cancer, is getting his body primed to fight something that's foreign cells. CBD is very effective for that as well. Different form for dogs, don't give this one to dogs, but it's still very useful. So I take this CBD also for anxiety. If I am very tightly wound, the other night I couldn't sleep well, I got up, got out of bed, and just took this, went back to sleep. Or I use it for the rare headache. I do have neck issues from the way my orthodontics were done. And so sometimes I just get stabbing, painful temporal headaches or infraorbital headaches when my neck goes out. And I'll be with patients, and actually, because I'm so used to not taking anything, I forget that I don't have to tolerate the pain. I'll do a couple pumps of the CBD and my headache's gone within 10 minutes. So it's very useful for that. So this is some of the detox supplements we have here in the office. You can watch some of the other videos if you like. I hope you find this information useful, and I hope to see you here at the office as well.